And then here we have everybody waiting for the door to be unlocked by our
And I took a video yesterday of our singing and clapping.
And here we have everybody else. Then we have post-op patients here ready too. As you can see, the patch on his eye. So yeah, it's just really, really fun what we do here. Especially when people ask to have...
It's a lot of work though, so don't just go thinking we're down here having fun and a blast.
Yeah, because
we
sometimes...
are, but we're working really hard.
Exactly, because sometimes you have to tell people that they can't have sunglasses. And that's hard, because some people can be very stubborn.
Yeah. Yeah.
And there...
A lot of work and a lot of Spanish.
Yeah, there is.
Or you have to have a translator.
And we have everybody walking inside. Right now, slowly.
We should do a tour around the thing now.
Let's do it.
So, okay, we're gonna act like we're patients. So
We can't. The door's not open.
Oh, right. Well, if we were patients, we'd go down there.
I will show you which door.
Yeah.
To this door right here, which so happens to be locked at this very moment in time.
Yeah. And you would come in here, like so. You would go to this desk. You talk to Nellie here. Nellie would write down your name and your occupation, your age, and like what's wrong with your eyes and stuff like that, and you get a paper. So then you take the paper and you just sit. Well, you might sit back there first if you have to wait, but you'd sit here and you have a class on health. Paul, you want to explain the class on health for us? Give us a little rundown of what
Brush your teeth.
Something like that. I don't actually know what they teach because I never get to listen, and it's in Spanish. So, but they have signs up there with lots of fun pictures on them. So anyways, after the health class, they do lots of things. Sometimes they she says one and they stand up, and then she says two and they sit down and they all laugh, and I don't know what it is. It looks like fun. They come over here, and they go down the ground, and they sit, and they wait for a while, and then they get to take a vision test, a far vision test. Okay. And they would look down there. You see the sign down there? Levi, you want to go demonstrate and point with your finger? Yeah, see Levi, he's been pointing for a long time and his finger is just never recovered. So he would go down there and there would be a translator here and we have to stand behind the line and look down there and we have to say, motion with our hand, like which way it
Put
goes.
this in your eye.
Yeah. Oh.
Yeah.
Wow.
So we put it over eye like so. We motion. If it goes this way, if it goes, oh my goodness, okay, that way, yep. And then that way. I can't read that one. And then they shake their finger like this if they can't see it. And then that way.
She's watched long enough, she knows.
Yeah, that's the basic drill.
I got the chart memorized. I can get it.
So then, once they're done here with the far vision test, they come here.
Not quite.
Sit. Oh man, we're done. Take a near vision test with this thing. You have to read the numbers and I get to tell them, look at this number. And then...
That's going to cut our thing short because we can just show you the rest later because we have to go outside and pray and sing.
And pray.
So we're going to go do
later.
that.
This is to be continued.
So,
later.
Más tarde. To be action.
Alright. We were with the near vision test. Sorry we left you so early, but we're going to finish it now. Anyways, you would sit down right here, like so. And I would point and I would say, I would tell you to cover your eye first. Tape su ojo izquierdo. See, you can't cover your eye. And then you would look here and I'd say, ¿Qué número es? And they'd tell me,
8.
Sí.
4. 8. 4. 3. 5. 2.
You can't see very well. And then...
You know what? There's a button called zoom in, okay? I lost my place. I had to find it.
Oh. So I would try and figure out like whether you had 2400 or 2070 or 2040 or 2020 vision. And then I write that down on a little paper. And I'd say vaya con ella, which there would be someone to take them, a runner. And they would go this way. And they go over here somewhere for a consultation with the doctors. So the doctors can tell me what's wrong. Chris, you want to tell me what's wrong with my eye? I can't really see out of it very well. And the sun kind of hurts it. And in the vision, it's kind of blurry.
Oh, you need to go to the OR.
Oh, the OR?
Yeah,
Where's that?
right away. On the street.
Oh, right. I'm just going to pop in my I don't know, truck.
Or we can get her a prosthetic eye if you'd like.
Ooh, that is a good
That's
idea.
number 6. We're coming to number 6. We're at station 2B. We're getting there. So, station number 3. I don't know if I can explain all these stations because I don't know if I've been to all of them. But
Station number 3 is only for readers.
Yes.
Those who only have a problem seeing close.
so you get to come over here and you get to pick out.
Well, they don't pick out. We pick out for them and see which ones they see best with.
Yeah. So,
And there are people coming, so I believe that I need to start translating. So I believe our job is done for today.
no, it's not. You pick out readers like these, and you can wear them, and they help you see better. No, you do. And then you can read better. And then station number 4 is over there. I
No,
don't know.
station number 4 is right here.
Oh,
What happens at station number 4 is Miss Joyce right here dilates the people's eyes so the doctors can see their eyes perfectly well and understand what is wrong with them.
And then they get prescription glasses if they need them.
And then, actually,
Yes.
man, yes sir.
So you
And then people sit here
Like-
at this line of chairs to find a prescription.
Hey, I'm giving the comic.
My camera.
Okay, whatever.
Anyway,
And then they come over here to the computer and they type in the little details like of the prescription. And then they come over here with all these boxes. And they would find the number. The computer would tell them the number and they come over here and they would find the glasses. And they take it back to the person over there and give them their glasses and say, can you see better? And they'd say yes or no. And they work until they find the right prescription. Oh. So, station number 6. We're getting to that.
there we go.
Prosthetic eyes, which is run by our good man Jay. And you want to give a little demonstration of what you do here?
We can do that.
That would be fantastic.
This is if what you have an eye that doesn't work or doesn't see, and you want it.
Or you have no eye at all.
Yeah, that too.
One of these in there.
Ooh.
Lots of different colors to choose from.
Well, actually, light brown and dark brown are pretty popular around here.
Yeah.
Blues don't go very well.
That's a pretty green.
And so then you shave it down if it needs to be shaved down. They
I have a
fix
ground
it.
tool here with a polish grinder and a polisher on it.
Yep.
Cool.
Lots of fun stuff. You can see Steve Shock if you want to see a real prosthetic eye
That's right,
and
Steve
at
Shock.
work.
Yes, Steve has a real prosthetic eye.
It's very fun. You should hear a story about when he played softball with it. He was like sliding into third base, and his eye popped out, and he caught it while the guy was trying to tag him. And Steve's like, "Oh my goodness, look what you did!" And the third baseman freaked out. He was like throwing up. It was so bad.
I would freak out.
Drinking cocktail parties. Or when he was in college, he stuck it in the mashed potatoes. The girl sitting next to him. She didn't talk to him for a year.
Anyways,
Not
lots of
cool.
cool prosthetic eye stories. And then the next station,
Number 8.
7.
7.
This is number 7.
When you learn how to count.
Yeah.
Yeah.
Counting is important. They do something here with these kind of cool looking machines. It like measures your eye somehow, like the depth of it, and then like the, I don't know. Chris, what do these machines do again?
These?
Yeah.
This one measures the length of your eyeball. And that one right there measures the roundness of your eyeball.
I
Oh.
knew it was something.
You almost got it right. You were close.
And that's used for what?
For people who are getting cataract surgeries.
Okay.
Yeah.
So the
It
people
helps.
at OR use that.
Yeah, the measurements are used to determine what size lens to put in the cataract patients.
Ah, that makes sense.
Oh.
Yeah.
That is
Something
smart.
today. So anyway, that's the people that are going to cataract surgery. And then people come here.
This is number 8.
Number 8.
Right there, you see
We
the
made
8
this,
in the room.
We spent a while taking this black tarp up to make the room dark so they could do a manual refraction. I don't know if anyone's in here that we can talk to.
No, Angela and Jenny are sitting over there.
Yeah. There's lots of cool things in here. I don't know what exactly they're used for. They use these things to look into their eyes.
They just use this to find out what kind of prescription they need so they can see their eyesight. I mean, so their eyesight can get better, is what I meant to say. It's actually pretty cool how they do
Yeah,
that.
they use little charts like that.
They use a baby chart.
Yeah, and so that's pretty much the general round of the place and how things work around here. And if people need more surgeries for something that's wrong with their eye, they take it to the hospital and the doctors, you know, go, and they, do the little surgery stuff. And then the post-op patients come back here in the morning for the doctors to come look at, make sure they're doing well after surgery. So I think that's
That was
most
actually
everything. Hi, ladies. You want to talk about manual refractions at all?
Do I want to? That's kind of a loaded question.
Oh,
Yeah.
well,
Do I want to?
you don't have to.
But I will.
Oh, okay.
What do you want to know about it?
Like, what exactly do you do? What's it for? Purpose of it?
We use a scope to look in the patient's pupils, a dilated pupil, look at the patient's pupils and look for their reflex. And we neutralize the reflex that we see in the pupil, and with the measurement that we see,
Tells us what the
we can find out what the prescription is.
Oh.
Right.
So they do that before they get their
And then
glasses.
we send them for their glasses. Yep.
All right.
And log them into the computer and find something to match them up.
Coolio.
Sweet.
Thank you so much.
Thank you very much.
And I think that concludes our tour for today. Thank you very much for your attention. Okay, you can stop recording now.